makes absolutely no impact on people's sexual orientation. But this research, and this is an example, led to and was partly responsible for statements across now all international organizations in psychology and psychiatry warning against these treatments and having statements that it's unethical for therapists to perform them. And this little chap who's down here is someone who was struck off just in April for doing these treatments. So there's a lot of protest from people who say they should be free to treat gay and lesbian people. They don't talk so much about freedom of the gay and lesbian people themselves. Also, we reviewed recently the evidence for harm in gay and lesbian people. Does this sort of discrimination lead to harm? And it's pretty clear that it does. There's twofold to fourfold increases in depression, anxiety, suicide, and substance misuse. Even psychosis, in a very recent paper we've looked at, seems to be more common. Now, we know right across discrimination that this happens. This happens in all discriminated groups. It's not unique to gay and lesbian people, but the confusion here has been over generations, because many of the psychiatrists were seeing people coming to them and they attributed the distress to the sexual orientation rather than to other things in the people's lives. And that was a real category mistake. Now, around the 1970s, as I've indicated, the American Psychiatric Association began to realize that maybe they were making a mistake. But it's almost hilarious the way they went about it. So I'm going to show you now. Sorry, this is what I'll skip over that because I've just said that. And that, but, oh sorry, before I do that, let's get into, I've got myself a bit out of order here, but if I go back to my little pattern here, I want to show you a bit about, I've left behind the activism bit of this, because the activism is just as important as the research, because hand in hand, they're very important. And I know many of you in this room would recognize that. Now, of course, Stonewall, everybody knows about. Stonewall was the start of the fight back against, particularly in New York, police oppression. What people don't always realize is that transgendered people here were extremely important in this. It wasn't just gay and lesbian people, and this club was harassed by the police continually, and it led to really riots. It led to massive demonstrations at that time, and this is a particularly crucial time just around 1970 and into the 70s. This led up to this pressure on psychiatry, and the gay activists started to disrupt American Psychiatric Association meetings. In 1971 they first had a panel of what they called non-patient gay people. It didn't mean that they were inpatient, they meant they were non-patient, and that meant that they were actual ordinary people who might come and give evidence to psychiatric associations rather than patients. But the one that's really fascinating and less known about is Dr. H. Anonymous. Dr. H. Anonymous was a forerunner of this process, and I'll give you a photo of Dr. H. Anonymous. This is Dr. H. Anonymous here. It's pretty obvious it's not so much here. And his name was John Fryer, and he gave evidence to a panel of the American Psychiatric Association, and it was necessary to wear a wig, have a rather ugly party mask, and dress in a tuxedo, because it was impossible, this is in 1972, for a psychiatrist to say they might be gay. And what he said was this: I am a homosexual. It's a really heavy stuff. I am a psychiatrist. Could have said it the other way around, I suppose, but and as psychiatrists or homosexual, we must know our place. I'm sure this was a very cryptic statement that was said. If we are to get an equal learning capacity or admission, particularly this one, to a psychoanalytic institute, we must make certain that no one in position of power is aware of our sexual orientation. He compared it to racism, and finally went on to say, we can't be with our real friends lest our secret be known and our doom sealed. It's almost Victorian in its language, but this was, the situation 40 years ago, in amongst what you would think were a fairly liberal group of people. This is him now, slightly more normal, and he died in 2003, a kind of hero. It might seem like not much of a hero, hiding behind a mask, but that was the situation then. And of course, that led to huge change. This kind of pressure from the gay groups, from the research, because the scientific committee looked at the research up to that point, and so they decided, the Board of Trustees decided to remove it from the Diagnostic and Statistical Manual. Now, I'm not emphasising this just because I'm a psychiatrist. This had enormous impact, and it still has impact today. When parents look up, when they learn their Gale's daughter is gay or lesbian, sorry, their son or daughter is gay or lesbian, they look up the internet, they're frightened, they think, oh, they can be treated. If this is still happening today, you can imagine what it was like then. And, but there was a fight back. The psychoanalysts, 2 years later, decided this wasn't right, wasn't clear to do this, so they wanted a petition to overturn. Can you imagine a medical diagnosis being formed in this way? You know, you have liver disease because the physicians vote whether you do or not. Anyway, they petitioned, and all the members voted on this. It's quite extraordinary. And, well, sort of grudging majority thought that it should stay as it was, and it wasn't overturned. So that's the kind of history of this. Just as important as all this is legislation. And we're seeing it at the moment with the marriage bill, but across the Western world, there's been a slow, positive step towards decriminalisation. Still, in many, many countries, this is not the case. Many countries are reversing, as I'll show you in a minute. And these anti-discrimination laws and equal rights and right through to marriage are incredibly important. They're incredibly important, obviously, for rights, but they're incredibly important because they sort of get this virtuous cycle of people being more open, which I think is really key. These are just a summary. You'll be familiar with them, but it's very easy to forget them. There's many more than this, but these are lots of things that have happened since 1950 through to the present day. This one seems to be stalled, as we're hearing. It's not quite clear what's happening to the marriage bill at the moment. But right from the original Wolfenden report, it's horrific to read these reports. If you go back and read, the BMA gave a report about homosexuality when in the Wolfenden report, when it compared, it had a report on prostitution and homosexuality, because the two seem to be equally evil. It put them together and to give evidence on the Wolfenden report. When I read this evidence, I'm surprised anybody actually thought decriminalisation was a good idea. But they did then, and you can see it was 10 years before any government was brave enough to actually do it. But then we go through here. You've got to remember that only in 1999 the House of Lords rejected an age of 16, an equal age consent. Right down here through to probably the most important one of all, was the Equality Act, that put homosexuality on an equal plane with ageism and sexism and the other isms. Now this one is a really interesting one, because this is the only one, again, you're very familiar with it, but I'm raising it for one particular reason, you'll see in a minute. This one was brought in by Thatcher's government. It was never really enacted particularly, but it had an enormous effect on schools, where I'm going to argue in a minute might be the best place for intervention. Cameron apologised about it, which was pretty extraordinary. And these were the two really big things that we all know about it. Not promote homosexuality, quite how to do that, and then promote teaching about a pretended family relationship. And that's really important, because there's one country that just this year has learned from Thatcher and introduced exactly the same model. I'm sure you all know where that is. Russia. And in January, their lower house of parliament pushed exactly the same thing, a draft law banning homosexual propaganda. The reason for this was that they wanted the population in Russia to increase. So one of the ways to increase the population in Russia was to do this. Of course, it's not true. I mean, they've been deeply homophobic. I think when a group of activists put up a plaque recently, it took 2 minutes before riot police arrived. So it doesn't take long to suppress this was in Moscow. It doesn't take long to suppress this, but the particularly nasty murder happened a few days ago, and it's thought to be on the basis of this. In many cities in Russia, this is really enacted out with great violence from the police. If anyone makes any demonstration, any demonstration is considered propaganda. Now, it's not only in Russia, across parts of Eastern Europe, this is very similar. So, again, what I want to say is, once we've got, I'm sort of trying to cover here at the moment, and in here I'm going to come back a bit, because in here there's been research on, well, what kind of interventions might help? And that feeds into it too. But I think what's really important is it builds down here, and this is the most fundamental thing. The more open a society gets, the harder it is to go back. But you can already see that societies do go back. This would not have been a question in the Soviet Union, for example. So where do these attitudes arise from? You know, why are we seeing these negative attitudes? Because I think it's really important to try and look at what are the roots of homophobia, and then, so what could you, apart from these very big legislative changes and activist changes, what could change? Well, you could spend the whole hour talking about what it was in psychological terms, because it's so complex. It's not quite like many other forms of minority discrimination, and that's why it seems to be so universal across history and across societies. There's almost no society that anyone can think of that has actually positively embraced homosexuality as a fact or a way of life. Even historically, that's the case. I mean, you know, we talk about ancient Greece. It was tolerated in certain elite groups. In the Maori people, in New Zealand where I come from, there was a certain toleration of a kind of transgender people. You can see that across other countries, but other eras and other histories. But not in the way we think about it today at all. Now, there's a lot of literature on disgust and studies of the brain that occur when people think about same-sex behaviour. This is particularly the case in men. And I'll come back to this down here because you find homophobia, sexism and paternalism travel together. Everywhere you look, you will find these go together. Dominant heterosexual men who seem to be dominant in society, you get a lot of homophobia. Religion, because that's paternalistic setting in most countries. Infection is really important. There's fear of infection in Russia at the moment because of this, and there was fear of infection during Clause 28, that somehow homosexual people infect other people. And I actually like this term, homophobia. A lot of people talk about homophobia as being a really difficult term that people don't like because it's not accurate. Well, actually, I think it's really quite accurate in lots of ways, because underlying it, even though it is just a prejudice and discrimination, is fear. There is a tremendous amount of fear among young men. And we see this all the time. I'm coming to this evidence in a minute. Fear about their own identity. Bullying men who don't, or boys who don't seem to be quite as masculine, is a way of making sure I'm not misclassified, that I'm in the masculine group. And this is very true here. There's now 2 or 3 studies showing that the most hostile, the most homophobic men have the most ambivalent sexual orientation. This is not a myth, because it always used to be, oh, well, it's just some kind of defense. But there is now quite good evidence from a psychoanalytical approach and from an ordinary behavioral approach that that is true. So, let me just go on a bit. This is one, and I'm going to finish in about 5 minutes. This is one saying, well, where does this evidence come from? There's a huge literature out there, and there's lots of reviews about what this is. But I thought this was a particularly interesting one, because this was a survey recently in the Netherlands. It was very simple. Among other questions was, should gay marriage be abolished? Nice question. And who answers it? Well, religious practice, as we've been talking about. Higher educational level against the question. Sex, men for the question. And again, these fitting into the religious practice. But what's really important, and I'm going to come to this now, the mother's attitude towards homosexuality was seen as really important in these families. Now, parental attitudes are key here, and they're key in lots of ways. They're key in terms of how LGB people feel supported, but they're key in informing those who discriminate. So first of all, the LGBT people, there's been a very good review of this quite recently, showing that if you look at these things that happen in gay and lesbian people, they suffer violence or they abuse drugs or alcohol, etc., and you look at, well, what determines that? The research is not very good, mainly not methodologically so much as how you get representative groups of people that have been bullied. And what we're finding is not very surprising, but the parental attitudes are really important. And the parents' knowledge and responses to their child's sexual orientation is crucial. Most of the men and women I see who are very distressed about being gay and lesbian have one thing on their mind, is what their parents think. this is younger people. And I won't go into what's